If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
Walmart Business is in the business of helping your business. Regardless of whether you're building bridges, building spreadsheets, or building lesson plans. Ooh, that looks fun. Walmart Business can help save you time, money, and hassle so you can focus on what you're building instead of what your supply closet is missing. In short, we take care of business so you can do more with yours. We're the Walmart you love, now for your business. Learn more at business.walmart.com.
I had that dream again. My small business needs to hire, but I don't use LinkedIn, and I hire an energy vampire. But also they're a literal vampire. And suddenly my team is spending all their time sharpening wooden stakes and buying bulk silver and rehearsing ancient chants, and then I wake up.
Don't let hiring nightmares ruin your dreams. LinkedIn Jobs' new AI assistant takes insights from over 1 billion professionals to create a short list of the best fits for you. Post your job for free at linkedin.com/quality. Start hiring today with LinkedIn.
Hi, I'm Dr. Raj, and welcome to the Med Prep to Go podcast. And I am super excited about this podcast. We're all about helping you pass the USMLE Step 1. And we're going to read 3 questions today, go over them, tell you the answers. So this is going to be from Biochemistry. And let's get started. First question. This is a 30-year-old man presents to the emergency department with shortness of breath, dark urine for the last day. He has recently returned from a vacation in Southeast Asia. He was prescribed medications by the local doctor for a urinary tract infection. Vital signs are within normal limits and are normal, except he's a little tacky with a heart rate of 115. Physical exam is unremarkable, except for the tachycardia I just mentioned. Labs show a hemoglobin of 8, which is kind of low for a 30-year-old, so some anemia, a normal MCV, a mean corpuscle hemoglobin concentration, that's an MCH3, it's normal, as well as that normal MCV, an elevated lactate dehydrogenase, LDH, and increased urine urobilinogen. Peripheral smear is notable for bite cells. Now, that is a classic buzzword when we talk about USMLE Step 1. Okay, so which of the following enzymes is affected by the cofactor deficiency in this patient? Well, that's a good one. Is it A, glutamate D-carboxylase, B, glutamate oxaloacetate decarboxylase, C, glutaminase, D, glutathione peroxidase, E, glutathione reductase. And the correct answer is, you folks are super amazing. You're right, it's E as an elephant. It's going to be glutathione reductase. The patient is presenting with acute hemolytic anemia that is most likely precipitated by an antibiotic containing a sulfa group, such as nitroferritonin or trimethoprim sulfamethoxylaxole. You know, it's amazing being, out of med school for such a long time. I just call it Bactrim nowadays. I really haven't called it the whole word, but yes, that is a classic sulfa-induced antibiotic. And nitroferritonin, not even a common drug we use for UTIs that anymore, you know what I mean? But okay, those are correct. And he was probably prescribed one of these, for his urinary tract infection. Patients with G6PD deficiency, which is glucose 6-phosphate dehydrogenase deficiency, have low levels of G6PD, an enzyme that protects red blood cells from oxidative stress, leading to the increased hemolysis in stress situations of stress. G6PD deficiency leads to a decreased synthesis of NADPH and glutathione from the pentose phosphate pathway. Red blood cells contain relatively high concentrations of reduced glutathione, thereby protecting against oxidant injury. Under normal circumstances, GSH levels are restored by glutathione reductase, which catalyzes the reduction of oxidized glutathione to GSH. This reaction requires NADPH generated by G6PD. In patients with G6PD deficiency, hemolysis often results from exposure to oxidative stress, such as infection, sulfa drugs, acidosis, and of course, we couldn't resist to put it here, fava beans. Choice A, glutamate decarboxylase is incorrect. Glutamate decarboxylase is an enzyme that catalyzes the conversion of glutamate to GABA and carbon dioxide. Glutamate decarboxylase uses pyridoxal phosphate, PLP, as a cofactor and not NADPH. Answer choice B, glutamate oxaloacetate decarboxylase, is incorrect. The enzyme metabolizes glutamate and ammonia into glutamine. This enzyme does not need NADPH. That's choice C, glutaminase, is incorrect. Glutaminase is an amido hydrolase enzyme that generates glutamate from glutamine, which is important for many cell cycles. For example, the Krebs cycle, the urea cycle. NADPH is not necessary for this enzyme to work. Choice D, glutathione peroxidase, is incorrect. Glutathione peroxidase catalyzes the reduction of various hydroperoxides, such as H2O2, to water via oxidation of the reduced glutathione without the need for NADPH directly. So what is the learning point of this case? It's going to be red blood cells contain relatively high concentrations of reduced glutathione, GSH, thereby protecting against oxidant injury. Under normal circumstances, GSH levels are restored by glutathione reductase, which catalyzes the reduction of oxidized glutathione to GSH. This reaction requires the NADPH generated by G6PD. In patients with G6PD deficiency, hemolysis often results from exposure to oxidative stress, such as infection, sulfa drugs, acidosis, and of course, fava beans. Let's do another question. We have a 20-year-old Gravida 1 Para 0 G1P0 woman at 16 weeks gestation. She presents to the obstetrician's office to discuss her amniocentesis test results. Her past medical history is unremarkable. Her father has a history of recurrent foot pain and kidney stones. Her vital signs are blood pressure is 114/78, heart rate of 82, fetal heartbeat is heard using fetal Doppler and has a normal heart rate of 143 beats per minute. The obstetrician explains that the amniocentesis reveals a deficiency in hypoxanthine guanine phosphoribosityltransferase, HPRT activity. Which of the following statements is correct regarding the action of this enzyme? A, it converts guanine to hypoxanthine into inosine monophosphate with help of nicotinamide adenine dinucleotide, NADH. It converts hypoxanthine to guanine into xanthine. Choice C, it converts hypoxanthine into guanine. Choice D, phosphoribosylpyrophosphate pyrophosphate is needed for the conversion of guanine into guanosine monophosphate. E, thymine is needed for its action. And the correct answer is D as in dog. Phosphoribosyl pyrophosphate, PRPP, is needed for the conversion of guanine into guanosine monophosphate. Hypoxanthine guanine phosphoribosyltransferase, HPRT, catalyzes the salvage pathway of inosine monophosphate, IMP, and guanosine monophosphate, GMP, from hypoxanthine and guanine, respectively, with PRPE as a co-substrate. The HPRT abnormality seen in this patient results from the accumulation of hypoxanthine and guanine, which are converted into uric acid by means of xanthine oxidase. The abnormalities can range from clinically unnoticeable in the mildest form to severe action dystonia, chorioamphitosis, mild to moderate intellectual disability, and self-mutilating behavior in the complete form of Lesch-9 syndrome. Answer choice A, it converts guanine into inosine monophosphate with the help of nicotinamide adenine dinucleotide, NADH, is incorrect. Inosine monophosphate, IMP, and guanosine monophosphate, GMP, are made from hypoxanthine and guanine, respectively. Choice B, it converts hypoxanthine and guanine into xanthine, is incorrect. Hypoxanthine and guanine are converted into xanthine by the enzyme xanthine oxidase and guanine deaminase, respectively. Choice C, it converts hypoxanthine and guanine, is incorrect. Both of these are free purine bases. Choice E, thymine is needed for its action, is incorrect. Thymine is used in many biochemical reactions, but not this one. What is the learning point here? Phospholipid pyrophosphate, PRPP, is needed for the conversion of guanine to guanosine monophosphate in the purine salvage pathway.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, Fidelity. How can I remember to invest every month?
With the Fidelity app, you can choose a schedule and set up recurring investments in stocks and ETFs.
Oh, that sounds easier than I thought.
You got this.
Yeah, I do. Now, where did I put my keys?
You will find them where you left them.
Investing involves risk, including risk of loss. Fidelity Brokerage Services, LLC, member NYSE, SIPC.
And let's do our last question for this podcast. This is a 42-year-old man presents to the physician accompanied by his wife with concern about short-term memory for the past 2 weeks. The wife says that he tends to make up stories rather than telling her the truth. He underwent gastric bypass surgery 3 months ago. Vital signs are within normal limits. Physical exam shows symmetric peripheral neuropathy in the lower extremities with motor and sensory changes. He is diagnosed with a vitamin deficiency. Which of the following enzymes in the Krebs cycle requires this vitamin to work? What a great question. The answer choices are A, alpha-ketoglutarate dehydrogenase, B, citrate synthase, C, methionine synthase, D, pyruvate dehydrogenase, or E, succinylcholine-CoA synthase. And the correct answer is A as in apple. It's going to be alpha-ketoglutarate dehydrogenase. The patient has vitamin B1, which is thiamine deficiency, presenting with signs and symptoms of a dry beriberi, including symmetrical peripheral neuropathy, characterized by both sensory and motor impairments, primarily in the distal extremities. Thiamine is primarily found in foods such as legumes, pork, brown rice, yeast, and cereals made from whole grains. Thiamine deficiency can also be seen as a nutritional complication of gastric surgery. The alpha-ketoglutarate dehydrogenase complex is a Krebs cycle enzyme that converts alpha-ketoglutarate into succinyl-CoA with thymine as its cofactor. Answer choice B, citrate synthase, is incorrect. Although citrate synthase is one of the enzymes of the Krebs cycle, this enzyme does not need thymine to function. Choice C, methionine synthase, is incorrect. Methionine synthase converts homocysteine into methionine and is not part of the Krebs cycle. Choice D, pyruvate dehydrogenase, is incorrect. Pyruvate dehydrogenase converts acetyl-CoA with the help of thymine as a cofactor. However, this enzyme is not part of the Krebs cycle. That was a tricky one. I gotta tell you, when I first did this question, I got suckered into D. I'm gonna admit that. So if you pick D, don't feel bad. I thought that was a really nice question for the board. I'm gonna predict this is the one that's gonna go on your exam. Choice E, succinylcholine CoA synthase, is incorrect. Succinylcholine CoA synthase catalyzes the reversible reaction of succinyl-CoA to succinate without the need for thymine. Key learning point: dry berry features impaired reflexes, symmetrical motor, and sensory deficits in the extremities. Another variation of dry berry is Wernicke's encephalopathy. This condition presents in well-defined steps, starting with nausea and vomiting, followed by horizontal nystagmus, ocular nerve palsy, fever, ataxia, progressive mental impairment, eventually leading to a Korsakoff syndrome if not treated with vitamin B1 supplement. The alpha-ketoglutarate dehydrogenase complex is a Krebs cycle enzyme that is responsible for catalyzing the reaction between alpha-ketoglutarate, thymine enzyme cofactor, and CoA, which forms the end product, which is succinyl-CoA. I hope you enjoyed these 3 questions from biochemistry. These are going to be super high yield for your USMLE Step 1 and Complex Level 1 board exams. I hope you've enjoyed this. If you want to learn more about me, please check me out on one of my social media platforms. Check out my book series for USMLE Step 1 or Complex Level 1. It's called Case Reports Beyond the Pearls. And for the clinical years, USMLE Step 2, USMLE Step 3, check out Beyond the Pearls. I'll see you during the next block of questions here on MedPrep to Go.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.